Hi, Dr. YASS here. This video is designed to discuss lower back pain and what would have to be considered the primary cause of lower back pain when looked at from an analytical standpoint. I have been going on the subreddits sections for lower back pain, for sciatica, and it is clear that there is rampant misinformation that has been perpetuated there, but it's really been perpetuated over the last 40 years since the MRI was designed and found the magical herniated disc. So any symptom in the lower back when a herniated disc is identified comes from that, is the theoretical basis of the medical establishment, that it finds the cause of pain simply because a herniated disc is found at the time the pain exists, which is known as correlative theory or junk science. The same thing could be said that if the MRI found that I have two elbows at the time I have that I have back pain, that the two elbows is the cause of the back pain. It's clearly insane. There is no logical basis for this. This is a cultural preposition that herniated disc cause pain. There is no evidence, scientific, theoretical, or clinical, period. And you're talking to one guy who happens to have the scientific, clinical, and theoretical basis for lower back pain. So that's what this is about. And what I wanted people to see is the relationship of the psoas muscle, also known as a hip flexor, to the lower back, and why there is a much higher sense that it is causing your pain versus the magical herniated disc, which, by the way, has been found in as many people without pain as with pain, which would make you have to question how it can be causing pain if it can be found in the same percentages as those without pain. That's a separate issue and a subject for another day. But let's talk about the psoas muscle. And the name of this is the muscle that has a hold on the back, and why it causes pain is because it is actually connected to all 5 lumbar spines. So I wanted to kind of show you this picture here. And if you can see, here's your lumbar spine, and right here, you see these muscles right to the side here, and right here. That is your psoas muscle, and it attaches to all 5 lumbar spine, runs through the abdominal cavity, and then attaches down at the inner hip. And what's interesting about this is that this is attaching to the back and literally the posterior aspect of your torso, but it comes anteriorly, comes forward in the abdominal cavity to attach to the inner portion of the hip joint. Okay, so number one, look at its connection. It's connected to all 5 lumbar spine. So if this muscle were to strain or go into spasm, wouldn't it certainly make sense that it would be pulling excessively on the lumbar spine and therefore create pain at the spine? Now, what I like to differentiate are those people who are having pain very close to the spine and those who are having pain in the lower back, say 2 inches or 3 inches off from the spine. If this is the psoas muscle, sitting just adjacent to it are the quadratus lumborum or lower back muscles. So you can see that these attach from the bottom of the rib cage to the top of the pelvis. Now, if the psoas muscle were to pull excessively on the lumbar spine, pulling it forward because it does connect to the hip joint anteriorly, going forward through the abdominal cavity, it would create an excessive arching of the lower back. And in creating an arching of the lower back, the distance between the rib cage and the pelvis would shrink, thereby shortening the lower back muscles, leading them to strain. So there is a potential that the psoas muscles can elicit pain literally right against the spine, or can lead to the quadratus lumborum or lower back muscles straining, creating pain 2 to 3 inches off to the side of the spine. Now, the reason that I'm bringing this up, that in fact the cause can be a muscle, is because if it is a muscle, then you could expect that there would be other physical indicators to show that. So for instance, if someone was looking at this person and their psoas muscle was causing pain at the spine, you would imagine that in them being shortened, which is the cause of the pain at the spine, or this certainly close to the spine, would be you would be able to see that in it being shortened, it would present as having an excessive arch in the lower back. So if we were looking at this person from the side, they would have a severe arching of the lower back. And where this is the front of the pelvis and this is the back of the pelvis, you would find that the front of the pelvis is pointed down, where the back of the pelvis would be angled. So if we looked at the pelvis from the side, this would be the front, this would be the back. You would see what's known as an anterior tilt. So from a postural standpoint, we would see that the person has an excessive arching and excessive anterior tilt of the pelvis. Another thing would be that if you try to bend forward, when you start, you would see that you have an arch in the lower back. If you have a healthy, proper length psoas muscle, when you bend forward, your back would reverse and curve and you would have a convexity. You would actually have a hunching. So the normal action of the lower back when bending forward is to go from an arch position to a hunch position. Well, if the psoas muscle has shortened, creating an excessive arching and is pulling excessively, when you go to bend forward, you're going to be greatly limited, and you're also going to see that even at whatever point you can bend forward, you still have an arching. The back is not being able to reverse its curve into a hunch. That is not a representation of a herniated disc. That's a representation of a shortened psoas muscle. So we have an altered posture and we have altered range of motion. These are indicators that go along with the concept that the cause of the pain is a shortened hip flexor or psoas muscle. These are independent of discs. So if you just want to say that the cause of pain is a herniated disc because it was found at the time you have pain, well, that's just pure nonsense. That's baseless crap. That's correlative theory or junk science, as I've explained prior. There's no difference in saying that than saying that I found two elbows at the time I had pain, therefore two elbows is the cause of pain. What you're looking for are correlative symptoms or indicators to reaffirm what tissue is in distress. And if you present with a severe arching of the lower back and your pelvis is pointed forward, and you have a major loss of range of motion going forward, and your back cannot go from a arch to a hunch, these are indicators that the cause of your pain is in fact the psoas muscle creating the pain right there. And there should be no longer any confusion when I say the cause of your pain is a muscle and the person is coerced into saying, oh, the pain's near my spine, how could it be a muscle? Ladies and gentlemen, there's the muscle attaching to all 5 vertebrae. Okay? So, if it was the psoas muscle creating your pain, well, the answer would be, how do you resolve it? And that is a muscular cause, therefore it must have a muscular solution, which is to say that you would have to strengthen the muscles that lengthen the psoas muscle, which would be the muscles in the back of the body, known as the gluteus maximus and the hamstring muscles. So the way you would want to resolve your pain at your lower back would not be to get a cortisone shot, an epidural nerve block, take pain medication, get a surgery for a disc. It would be to strengthen the appropriate muscles to lengthen the muscle that is literally eliciting your pain. Let's not be confused. I am not one of these people who are saying the pain is coming from a herniated disc and somehow if you do something to muscle in the area, you're taking pressure off the disc, thereby ending the pain. That's bullshit. That's meaningless crap. The pain is literally being elicited at the point where the psoas muscle attaches to the bones, the vertebrae, because the muscle is in distress. So the only way you resolve the distress of that muscle is through the strengthening of the appropriate opposite muscles, which are the hip flex, the gluteus medius and hamstring muscles, the hip extenders, which do the opposite to the hip flexors. Hopefully this is a visualization now. Now you've got a picture. Now you've got something to understand, to help you understand why you've been doing the herniated disc nonsense. At some point you got to give up on it. You got to recognize that it's not you which is the reason why you're not getting better. It's not that you haven't gotten the right treatment for your herniated disc. It's the idea that the herniated disc isn't causing your pain. Once you wake up to this realization and you give yourself the freedom to see outside the medical establishment, you actually will have a chance to resolve your pain. And if it is, by the way, the psoas muscle creating pain, this is something that resolves in weeks. We're not looking at months or years. All right? This is the YASS method. This is how we do diagnoses here. This is how we establish cause. All right? If you have any questions, or you want to make an appointment for a Skype or Zoom session so I can help you diagnose the cause of your pain, and if it is confirmed to be muscular, show you how to resolve the pain quickly and effectively, by all means do so. You can contact me at my email address, drmitch@mitchellyass.com, drmitch at mitchellyass.com, drmitch@mitchellyass.com. If you like this video, give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe so you can get notifications when I add new videos or when I'm live on YouTube. All right? Let's work together. I'm telling you, folks, this is your path out. The medical establishment wants you to believe that it has a monopoly on pain and therefore you can never leave it. Regardless of their ineptness, regardless of their ineffectiveness to resolve your pain, they think you will stay forever because they think you think there's no alternative. The YASS method is your alternative. It's outside the medical system. It is a analytical, logically based method of diagnosing and treating symptoms, including pain, not simply treating them. And it will show that in more than 98% of cases, the cause of pain is muscular, which means you have a fitness-based problem, not a medically based problem. That is why the medical system never resolves your symptoms. All right? Get the YASS method, spread the word, let people know that this exists. Let's give everyone the chance to resolve their pain and live a pain-free, fully functional life. Everyone deserves that right. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.